bias and 2C. And for today's video, I'll demonstrate how to perform Benedict's test. And for the assessment, determine the need for Benedict's test. Assess the client's overall condition, and determine when the client last voided or was last tested for urine analysis. Determine if there is a near barangay health unit for more comprehensive testing if there is a history of hypertension, diabetes, or preeclampsia in the family. For the planning, prepare all the equipment needed. So materials needed in this procedure are sage and OB bag. Note that you should allow adequate time to perform the urine testing, and this must be performed during a home visit. Other equipment needed are sterile urine specimen, bottle, Benedict solution, test tube holder, alcohol lamp, denatured alcohol, matchbox, newspaper, dropper, and clean gloves. For the implementation, prior to perform the procedure, introduce yourself and verify the client's identity using agency protocol. Explain to the client what are you going to do and why it is necessary and how he or she can participate. After that, perform hand hygiene and observe appropriate infection control procedures. Next is provide for client privacy, so if necessary, ask po natin yung bantay or family member na umalis muna sa lugar kung saan gagawin ang test so that the result will not violate. Place the bag on a paper lining. Put the strap beneath the bag. Open the bag and put the plastic lining and spread it all over the work-filled area. Put out the necessary equipment needed, such as Benedict solution, alcohol lamp, sterile urine specimen bottle, small cup, clean gloves, denatured alcohol, test tube holder, test tube, and matchbox. And dropper. Put clean gloves. Then next, hand the sterile specimen bottle on the client, then ask the client to have a midstream catch of the urine specimen. So, I'm going to obtain the urine specimen to the client. So, I already obtained the urine specimen of the client. And the next things to do, put the Benedict solution on the measuring cup, obtain 5 ml in total. Light the alcohol lamp. And hold the test tube using the test tube holder facing away from you. As you can see, the Benedict solution is still blue, which means the solution is pure. After testing Benedict solution for purity, add 8 drops of urine specimen in the solution. Heat the mixture for 2 minutes. Allow the mixture to cool down and observe for changes in color. Allow the mixture to cool down and observe for changes in color. As you can see, the solution is still blue, which means the solution is negative. These changes indicate blue for negative result, green 0.1 to 0.4%, yellow for 0.5 to 1% presence of sugar, orange for 1.1 to 1.5%, red for 1.6 to 2%, brick red 2.1% above. Disregard the specimen or solution to the proper disposal. Disregard the specimen to the proper waste disposal. Before put back all the materials in the bag, alcoholize and clean the things used. And put out the gloves. And put back all the materials. Fold the plastic lining properly and place back in the bag. For the evaluation, reassess and evaluate the comfort of the client after the nursing care. Notify the healthcare facility responsible regarding the results. Perform a detailed follow-up based on findings that have deviated from expected or normal for the client and teach the client how to do proper follow-up and provide other appropriate instructions for the documentation. Document the procedure including the test performed and resulted in the client record using forms or checklists supplemented by narrative notes when appropriate. Record findings and nursing care given, and make an appointment either for a clinic or home visit. That's all for this demonstration. Again, I'm Desi Velasco, your student nurse for today.